Namaste. I welcome you all to this 21st session of Gurubodha. Coming directly to the topic, it appears as if every week there is a new variant of the coronavirus and news channels, and there is kind of mass hysteria. And so now, in the last week, we have this Omicron, and the rate of transmissibility has been very high in this. 25% of people who were tested in South Africa were testing positive, which is a very high rate of transmissibility. And but from what we know, from the information that we have thus far, is that the hospitalization rate is very low compared to the other variants and all. And this particular virus carries 30 new mutations on the spike protein on the coronavirus. Usually, one mutation means one new variant, but it has undergone 30 new mutations, and suddenly an entirely different form of coronavirus has come up. The reason for that is told as coronavirus has stayed in the non-vaccinated persons for several months and finally figured out a way to infect via multiple mutations, meaning over a period of several months, it was undergoing mutation. And now that it has figured out a way to infect and be show its symptoms. New viruses have become very common. There will always be new viruses, new bacteria. Even in the bacteria world, also several of bacteria are becoming drug resistant. The antibiotics that were considered as top order has become useless now. For a new set of antibiotics are coming, but in Ayurveda the approach is different. Guru Raja sir, rather than worrying about new variants every week, we should be concentrating on our health, improving our immunity, and making our body robust by natural Ayurvedic ways, because there will always be a new variant next week.
So definitely, there is no meaning in going behind those viruses. Let there be any number of mutations and any number of transformations. Let us keep our body, our host, our home very safe by using various techniques like Sadvrutta, by consuming Swasthahita Dravyas, by maintaining proper Agni, following the Dinacharya and Ritucharya, doing proper Vyayama, and all these things, followed by even meditation, dhyana, pranayama, all these rituals and the holy practices definitely, of course, added upon with certain rasayana and swasthayata dravyas, maybe even some vajikarana dravyas, they tend to act as immunomodulators, and they stimulate the immunity in such a way that we will have a resistance to new mutations and all those things. So that's what then expected out of our body, what we are supposed to do it. But unfortunately, the people will run behind so many other things, and they think that simply taking one or two drugs or single herbs or something like that give them a very good quality immunity. That is not true. That immunity has to be maintained with many set of functions, like even following Sadachara, Sadvrutta, Dinacharya, Ritucharya, Vyayama, and even better quality sleep, Nidra, everything. If these things are followed in a proper manner, and of course added upon with certain rasayana dravyas, definitely it will do things. And we need to take care of our host body. That's what very clearly the previously even the westernized many people like Louis Pasteur has said, host is everything, microbe is nothing. That we need to keep in mind. A host is everything. We need to keep the host proper. Once your host body is proper, then we can face any number of mutations or anything.
I think even the several Ayurveda experts are missing is the first point that you told regarding Sadvrutta and Sadachara. In the chapter of Janapada Dvamsa, Master Charaka clearly enlists lack of Sadvrutta. Sadvrutta means a healthy code of conduct, a righteous code of conduct, respecting gods, respecting elders, respecting teachers, and following the rules, being positive, spreading love, spreading positivity, spreading brotherhood rather than hatred. So that is also so very important. It's not like we just maintain a healthy life by just taking a few herbs or medicines. It's also a lot about our daily conduct, daily behavior, and all. And this world, as we see it, is not just a collection of few living beings and few microbes and few plants. It's much more, and cosmic energy, all those things play such a vital role. We need to take care about those aspects as well, so love and positivity.
Definitely, we need to have that positivity in our surroundings, and we need to send the positive vibrations and to get positive vibrations. So that is what it is expected out of that. We need to send good things in the form of taking care of people who are really in need of our help, and we are even including the doing good things to the environment and maintaining the healthy relationship with even the surrounding atmosphere. And if we are doing all these things, definitely that is what the Sadachara has said very clearly, the righteous behavior, what we are supposed to do it. If you follow that, that is a very important, because we know that nowadays every disease has been said, but previously there was a very clear cut separation of psychosomatic disorders, somatic disorders, and psychic disorders. But now the people have said, therefore, in every disease there is a psychic content or somatic content. So everything is almost psychosomatic, and we need to maintain the manas, we need to maintain the proper higher functions. So otherwise, it may give some trouble. That's what we are seeing in many of the systemic diseases also, where there is a stress component or something from the mental stature. If something comes from that angle, then there will be abundancy, or even the virulence, or the disease manifestation will be much robust or much troublesome. So that's what very clearly suggests that the mind involvement. That is the reason always our acharyas have said, whenever there is something wrong we want to search, don't go out searching in the outside, search inside, go inside. That's the meditation, that's the real thing what they said. So we need to understand our body, our nature, our mindset, and everything, then accordingly send the positive vibrations, so that the things will be in a right way. So that is the reason we need to maintain a cordial relationship between our surroundings and even all other our co existing microorganisms, it may be, or anything which is living in this world along with us. So this earth or this galaxy even belongs to them. So they have all their rights to live it. So of course we need to protect ourselves. At times we need to kill something to live. That is natural existence. So we need to take up only those part of it which is explained in Ayurveda, that is Sadachara, Sadvrutta, and even following a good character and conduct, and doing good things, sending positive vibes, maintaining Dinacharya, Ritucharya, Vyayama, Nidra, and all these things, definitely added with certain herbs. They are very clear rasayana dravyas. Definitely the immunity part will take care of. And once immunity is taken care, then automatically host will be sustained, and microbe is nothing which we can face the microbe in any mutation format.
Yes, and one important thing that observed in your narration was that we have to show love and respect to all people, but it should not be at the cost of our own interests also. There's a famous clinical psychologist called Jordan Peterson. He says, before going and changing the world, changing the society, and bringing society into right track, clean your room. He says that is just one of the famous sentences. I mean that cleansing, cleaning, and detoxifying the society should start with detoxifying ourselves, our body, our mind, and how we think and all. And another thing, I mean, just today I read it, so I remember it this one. One major problem that we all have is like lack of content, lack of content and satisfaction in what we have or where we are going. There's no sense of happiness. Like we are craving all the time. A lot of apps are coming, a lot of smartphones are coming, new technology is coming, crypto, web 1, web 2, and web 3 is coming. But still we are not like, I mean, there's no satisfaction content here. So there's a famous thinker called as Ravel Navikant. He's an entrepreneur, and I think he says, if you cannot enjoy your coffee today, you will not enjoy your yacht tomorrow. Whatever the building, whatever the sophistication that may come to you, as long as you are not enjoying the coffee that you have today, you will not enjoy a big building or big yacht or luxurious home tomorrow. So we need to be in present and enjoy the moment rather than worrying too much about future. So
Definitely. You see, we should have a proper planning for the future. There is no problem. It's not a taboo that we should not think about the future. But thinking too much about the future and not living in the present, this is also not right way of living. We need to enjoy, we need to understand, we need to be, healthy in such a manner that our thoughts process should be very neat and clean. We should not have any negative thoughts regarding, for example, why these problems will occur means many a times whenever there is a situation, people try to compare with the fellow friends. He is having that vehicle and I am not having this vehicle, and he is having that building and this much of land and I don't have this. He is having that much of gold and I don't have. So all these things will going to cause. My life is my life and his life is his life. When you, until unless if you don't understand this, then you will be always be trying to compare with the people, and that comparison always gives you trouble and it leads to pain.
yeah, and recently Twitter's CEO Jock Darcy resigned, and his place has been taken by Parag Agarwal. And he's from IIT, and suddenly he has become a millionaire. And starting from Elon Musk, a lot of famous tech celebrities have started following. And there was a joke going on here that time for every engineer to quit the WhatsApp group, family WhatsApp group, because every engineer in India will be pressurized that see, Parag Agarwal has gone to CEO position when you are going to CEO position. So comparison and deriving sadness out of happiness of other people has become kind of a trend these days.
No, that's what many times we see that there's a famous saying in Hindi. हम आपसे अपने दुख से दुखी नहीं है लेकिन दूसरों के सुख से दुखी है. We are unhappy because of somebody is happy. That is the main problem. So we need to be very, very careful in this. His life is his life, my life is my life, and enjoy the life what you have today. And if you are able to breathe, laugh, can see, and you can walk around, definitely feel free and happy. Say that I am doing all these things, because in world there are so many people they can't do all these things what you are doing today. So that is the one feel we should have. Of course, comparison is good, but compare to the level which is required, not beyond a certain limit. Going on comparing for every nook and time and just trying to point out the things and trying to achieve a new goal and all those things. But it should be in a healthy race. It should not beyond a certain limit.
So what are the measures to come out of this negative rut? For example, I am jealous. I have negative thoughts. I have nightmares of other people succeeding, which is keeping me up all night. I'm not able to sleep. So it is there with me. So how to come out of it? I mean, it's very so natural that there's a thin demarcation between healthy competition and feeling jealous and self-inflicting pain. So what are the steps to come out of it? Book reading, positive people, going to temple, yoga, pranayama. Do you have any steps?
It's a very, very clear. If you are looking at other fellow and his growth or her growth and trying to compare with you, you are spending your certain quality time. If you spend this quality time for how you can grow yourself, how you can think for future, what you can do it, and how you can run it. If you think on those lines and concentrate only on what you can do with your life, don't compare. Just do whatever you want to do it with your life. If you start doing and using your time for your life, automatically you will not be in a position, or you will not be in a way of understanding others or trying to compare with others in a bad manner. So it should be such comparison is good, just it gives an idea or a direction where you have to run, but it doesn't mean that don't try to compare that he has gone wrong and I have to go, be fast or something like that. So such type of competition is not at all good, and it definitely gives unnecessary stress factor inducing related to a lot of diseases, and even of course its effect will be on heart. Most of the time will end up in heart related disorders. rather than mind related. People will think that there's something happened to mind. We will go to heart because manas is present in heart, and definitely there will be problem with that. So we need to understand that. Of course, there is a competition. We need to know the competition, but we need to bifurcate or demarcate somewhere that I should not run beyond this. Let me have this much, and I should concentrate only on my running. I should not concentrate on my fellow runners who are running. So if that type of mentality if we inculcate and we try to do that, and of course controlling the mind and doing all these things will definitely come by meditation, dhyana, and the way we develop ourselves and the way we involve in this type of comparisons. So definitely we can control ourselves, saying that I should stop here comparing. Whenever if you are feeling you are going beyond certain limit, you should tell yourself this step, the way of self-containment or controlling the things is the first thing. You should put brakes to your thoughts, and that's the way of your handling it. And of course, many a times when this happens, unnecessarily you lose your night sleep thinking of something other than that. If you think in other way, you would have slept normally, and you would have enjoyed the next morning with very bright, with the clarity of mind and no hangovers. But you lost your important sleep in the night, and then the next day you will get up with hangovers and still sleepiness, and your next day is also spoiled. So that's what the way we need to understand, that unnecessary thinking, unnecessary comparison must be stopped, and that is forcefully stopped by many times.
I mean, we have a YouTube channel, Instagram channel, and all, but there are several other YouTube and Instagram channels with millions of views. I mean, one day they put out the video, and next day there are like millions of views. So when we put out, we get only 100 to 200 views. So our employees were also worried that why our channel is not growing in comparison to others. So what we decided was, let's compare ourselves last month versus this month, last year this month versus this year this month. So let's compare our own growth, and as long as there is our own growth, we need not worry about others. We'll get there. It takes time, and as long as we get new ideas, and as long as we are creating new content and putting our honest efforts, results will come. Comes back to God Krishna's karmane vadikarase mafalayasu kadachana. We have the right only for the hard work, but we do not have the rights on the end result. And even in the modern gym going people, they'll always compare other people and feel bad. So David Goggins, one of the motivating speaker and best-selling author, he says, take a picture of your body in front of a mirror every day when you're going to gym or running or whatever, bodybuilding, and compare week by week. As long as you're feeling better, you should not be worrying about other people are not getting 6 packs or 8 packs. So probably that is the way to go, sir.
So definitely comparing our own performances and trying to win over the things, and setting our own targets and goals, and achieving and breaking the records of our own records. That is a nice way of doing things. That is a right way of doing things, and that will definitely give scope for the growth. But unnecessarily compare with the others, then you will have a lot of issues, and it will make you to land in trouble, and that should not be done.
After Sadvrutta, you talked about Dinacharya. We have another professor, Dr. Sandeep Bekal. So while explaining about, he was taking class for us in the Dinacharya, and he said that, so whatever we do in the Dinacharya chapters that Ashtanga Hridaya and Charak Samhita explain, so Anjana, eye cleansing, a sort of detoxification of eyes, then there is Nasya, then there is Kavala and Gandusha, then Dhumapana. So all these are in a way kind of creating a protective layer over the nasal mucosa or the eyes, and in the oral mucosa, along with the detoxification, with following all these, including Vyayam and other things. One is many detoxification every day, and also many strength building and protecting our orifices and protecting our point of entry of microbes like eyes, nasal entry, ears, oral cavity, and so on. So,
Definitely, that is the reason why the Dinacharya has been told. It is removing the malas from the various orifices and as well as trying to maintain the efficacy of those areas and the tissues over there, and to maintain that beautiful concepts of Dinacharya has been explained. And probably the only science in the entire world which speaks about these much about how to maintain the healthy body. I think Ayurveda is the one science which speaks about with all these things and how according to the nature, how the seasonal changes and what should be done at what time, all these things. Of course, this type of clarity, I think it's only Ayurveda can prescribe to the world, because it's one of the wonderful science which has explained all these things in a very beautiful manner. And you just remember these informations being given by our acharyas, even maybe after a lot of trial and error, and ultimately they are given the truth, and that too without charging anything. It is a free of cost. That is a very important. Nowadays, anything if we have got everywhere, that is a intellectual property right, and there's something, and we need to have some royalty or something like that. But our acharya is given bundles and bundles of data and information, science, knowledge, and without charging anything. That is a truth, and we need to keep in that mind that we also supposed to maintain that thing, and we also supposed to give certain things to the society in return. We need to do some seva, some sort of works and some sort of activities which will definitely carry on this legacy of giving this information and giving the seva and even all these things to the next generation. It should be carried forward.
yeah, one thing that I observed is there was a group discussion in which somebody said that and when some doctor asks about treatment plan, we should not, I mean, the doctor who is treating may or may not explain the treatment, actual medicines and actual therapies, but just a general line of treatment is sufficient. But you came forward and said that we need to, I mean, if we have treated the case successfully, we should be bold enough to explain the treatment, the dosage, the actual medicines, and why you prescribe. So I have seen that in every case discussion, you come forward and voluntarily explain the whole thing without hiding anything. So if you really done a good work, and if you really want to help other people, you have to tell it all. Otherwise, there is no point in self boosting, and it will be just a self promoting exercise. I have treated this disease. So,
See, very simple concept is that if I have done at my clinic my setup and I got a particular type of result, I would like to understand whether this result is just an accidental result or it's a reality. So then I should give out this combination or formulas or the and similar type of conditions in the different geolocation conditions. If they try and do it and if they also get the results, then that is a very important, and that gives a confidence not only in the science, it also gives confidence in the way we carry forward the information. So that is the reason we need to go for these type of things. Of course, when we do a multi-center trial and that type of thing, that is a protocol, we do it. Otherwise, here it is an independent place, and where people, if they want to try out my formulas, I am most happiest person to give out the formulas. Let them try, let them come back with their results. Then let me compare with those results, and where I made mistakes or where they made mistakes, there is always a scope for the correction and improvement, and definitely this will going to increase the knowledge of understanding as well as their implication in a different set of conditions, and that will be a very nice way of treating a person as well as maintaining the legacy of Ayurveda and carrying forward those information to the next generation. We need to, because today if I am able to get all this information and I could use it for my patients and my prosperity, then it is my responsibility that I should hand over these information and these things to my next generation, that they should carry forward. So that's why There is no question of hiding anything in here. Whatever it is, the case we have taken, we have used it. What are the medicines we use? Even I say, even which company I used it, because let them have benefit that we have used those companies' products. Let them also have the benefit of and even people will get the confidence of using those things, and multiple center at multiple times people are using a product, then automatically the validity and product and the brand building of product will takes place. And not only that, even the people will involve in understanding and using Ayurveda, and thereby the promotion of Ayurveda takes place. So there should not be any question of hiding or some such type of things. I don't recommend any of that type. I'm very open to that. What are the medicines we use, that should be said to the people who ask it.
One thing that I observed from your statements was that you also want to, like, if you have committed mistake, you want to improvise, maybe try medicines which other people have used. So after 20, 21, 22 years of Ayurveda practice also, you see that there are chances of learning, there are chances of improvement. And one of the problems that I see in some Western, this is not to blame others, just for improving. Some Western practitioners is that they have learned Ayurveda for 5 years, so they know everything. So, and I am an expert in Nasya. I am an expert in rhinitis. I can treat everything. So that's not the right approach, and we should be very humble, because one thing I have recently saw is in Dr. Devi Prasad Shetty, a world-renowned cardiologist of Narayana Hridayalaya. He said in one of the interviews that some cardiac patients in whom they are very sure to make him survive, they usually lose the patient. And some cardiac patients in whom there is no hope at all, still they survive. So it's not like I know everything about such and such disease. There's always something to learn, and being humble and being always be learning is the mantra. So.
Acharya has very clearly mentioned this in our classical text, that we should not, with a confidence and a surety and these things, we should say that I will treat this condition definitely, particularly when dealing with Vata Vyadhis. Very clearly, Acharya has said, don't give any sort of such assurances. You don't know how this Vata Vyadhi behaves. You may be thinking that this disease can be very easily I can control, and it may just straight away slip away from your hands. And very hopeless case maybe miraculously gets survival and becomes normal. So this is a very quiet thing, and we are here just as a moderators. We are not God. We are here just to do a moderation in between, wherever there is a possibility of rectifying those disease parameters, that we will be doing it. So for that reason, I should not claim that I am an expert in that and I am expert in this. God only knows who is expert.
And there's a question here. Which herbs can be used to reduce tamas, negativity, selfish thinking, ego problems, jealousy? Can those be treated with herbs and therapies, or just the psychotherapy or counseling is the way to go?
Counseling and psychotherapy or something like that, it is a must. And here, counseling, sankalpa, that part plays a very important role. And of course, Sattvavajaya Chikitsa should be done. As a part of herbs, what we can recommend here is, the one is Manduka Parani, the very important herb. Then other one is Tulsi, what I recommend. And the third one is Shankapushpi. These drugs will definitely do certain influences on the mind, and they help to come out with some sort of that negative feeling will be cleared off. So that the reason we suggest that these herbs can be improving the sattva, so it can be taken. But along with that, just simply don't depend on the herbs itself. You need to go for the counseling, sankalpa, and even patient should be made to feel that yes, I can do it and I will do it, or I won't do this one. That type of sankalpa, if we could able to do it, then only the things will settle down.
Interestingly, you mentioned about Tulsi. Apart from regular, regular health benefits and medicinal benefits, it has some spiritual angle to it also. We drink Tulsi water after doing abhishekam to the gods in our Hindu culture. We take and eat leaves of Tulsi as part of as prasadam. So it helps to control or curb our excessive external attractions, excessive sexual urges, and controlling the Indriyas is probably one of the benefits of Tulsi. Sir.
Tulsi is one of the drug which enhances the sattva of a person. So once the sattva is improved, which automatically suppresses the tamas as well as rajasika qualities. So if the sattvika qualities of a person is improved, automatically rajasika and tamasika qualities will go down.
Yes, sir. And this is a little bit of a cliche question. We know that Omicron is not that much of a real threat, and I mean, as long as we are doing good on healthy daily activities, Dinacharya should not be worrying. But still, I get a lot of these questions. That's why I'm asking you. If you decide on four or few herbs which you recommend to take on a daily basis as a immunity booster, which would be there, sir?
Definitely, in these conditions, as well as the other issues related with immunity, the few important drugs which I rely upon are particularly Estimadu, Ashwagandha, and particularly Kalamegha. These drugs are very good, and even Haridra. Of course, Guduchi. So these five drugs will definitely do the things: turmeric, Kalamegha, licorice, Ashwagandha, Guduchi.
So, lot of stress there on immunity, body nourishment, respiratory health, and rasa rakta shuddhi.
Definitely, it can take care of Agni, it take care of Rasa, it can take care of Rakta, Mamsa, Meda, Asti, all these seven dhatus. So it can be taken care, and that is the best combination. We can go for it.
And any particular medicines to have general immunity, especially with relation to respiratory and cardiac health in these periods of viruses.
You see, even the government of India has come out with that Ayush Kwata tab and Ayush Kwata churna. That also has a four combination. That is also one of the important combination. And there are so many companies. They have got many of the immune related models like Immunop and Immusol, Immuno. There are many such immuno components are there available in the market. You can use them, and most of them do contain these drugs only. What I listed out, such type of things either in the form of Pippaliyadi Gritha or Indukanta Gritha or Pippali and these type of drugs. With that, the thinking in the backdrop is that Agni should be maintained, Agni should be proper. Once the Agni is good, then definitely the things will get absorbed, and of course our body very clearly said Kaya Agni, if it is good, it retains all other Agnis. So that's the reason our Acharyas have also very clearly stated that all the diseases are produced due to Manda Agni. So in order to maintain that, we need to always keep up Agni in a normalcy.
How do you rate Chyavanaprash, sir? One of the problems that I and many doctors I speak to come up with Chyavanaprash is it is such a famous medicine that everyone knows about it. And when the doctor prescribes Chyavanaprash, for example, oh, that we already know. Why would the patients come to doctor to prescribe? So this is kind of a common phenomenon. Do you ever prescribe Chyavanaprash, or is it having significance in this world of viruses?
Definitely, Chyavanaprash has its own role, but fortunately or unfortunately, in market, whatever the Chyavanaprash is available, it is made rich with extra sugar. If you really prepare the Chyavanaprasha as per the lines given in the book, that will not be so tasty. What presently Chyavanaprashas are there in the market. So if it is Chyavanaprasha prepared in a textual manner, how in a good manufacturing practice as described in our Samhitas and Sharda Samhita and such type of things, then people will automatically feel that this is not the right type of thing. This Chyavanaprash is not good. That Chyavanaprash is very tasty. So ultimately, they come to the taste, not the efficacy. So for the point from the efficacy, if it is concerned, it is better. We need to go for any combination. You can go for Kushman Rasayana is also good. You can even go for the Vasavaleha, that is also good. But at this point of time, depending upon the workplace and depending on the type of season and everything, we can select. But now, as you pointed out, in the winter season, of course, Chyavanaprash is one of the good option. It can be.
Yeah, as a question here, what are the best medicines to increase bones, nails, and hair health for menopausal women so they do not develop arthritis? And if these women have developed arthritis, what can be done either to reverse or arrest the progression of arthritis? So bone health takes a beating once the woman goes past menopause, largely due to lack of estrogen supply. How to go about it, sir?
Panchathikta Guggulu Gritha. Panchathikta Guggulu Gritha with Lakshadi Guggulu, that is sufficient, which take care of your bone health as well as your hair and nails and everything. Still, if you want to add on, then there is a Gandha Taila. This will definitely help to retain the bone mass, bone strength, bone health, everything. Panchatikta Guggulu Gritha or even Mahatikta Gritha, because these Tiktaka Gritas are very good in Asti Majjavaha Shrotasas. So Panchatikta Guggulu Gritha or Mahatikta Gritha, Gandha Taila, Lakshadi Guggulu. These are the certain combinations which you can make it.
And there's another related question. So I personally am not against, say, vitamins or calcium supplements. I mean, my line of thinking is that if patient has clearly B12 deficiency, if it takes vitamin B supplement, then it would increase. Of course, the dietary supplementation is better than medicine supplementation. I mean, supplementing with medicines, but still, there is a clear problem and clear medicine it can be taken. But several Ayurveda people think that in this case of calcium deficiency and lack of bones and all, the argument is that let's develop the Agni, let's improve the Agni and correct our Agnis and Srotasas and Kostas and Dhatu level corrections. Let's do, and that will only take care of vitamin supplement deficiency or folic acid or hemoglobin or calcium. So the argument is that there's no need for direct supplementation. What is your line of thinking there, sir?
See, it's very clear. There should be supply. If supply is there, then only if channels are open or the shrotasas are open, Agni is functioning, then only it can imbibe the things. Modern medicine or that Western system has identified a vitamin B12 or vitamin D or something like that. Ayurveda have identified it in a different manner. May not be exact correlation, we don't find it. So for that reason, their existence cannot be accepted or taken. That is not the truth. I cannot say that my God is only God, there is no other God. That is not a way of thinking that. My God is something which I know in my format. There may be some other formats also. Ultimately, everybody is trying to reach to God. So, similarly, this particular Tiktaka Gritha and these type of combinations, we use it. Definitely, it improves the bone health and it opens up the Agni, as well as it improves the Agni, it clears the channels and it is giving nourishment to the bones and even Asti Majjava Shrotasas. So you'd say usually these combination will definitely help. But for example, in any case, a patient comes to me with all sort of these pain and all those things, and they also come with a report saying that her vitamin D is very, very low. I don't hesitate to just replace vitamin D what is available in the market. By using vitamin D, that will be given. Clearing the channel and improving the Agni, that I will be doing it. But supplementation of vitamin D is also to be done. I ask the patient to stand in sun, take all available vitamins like D-Rise or whatever it is in the brands in the market. You take accordingly. There is no harm in it. But maintain the things along with that proper Agni and all those things and channels, and then rest of the things can be done later on. But initially, when there is a very deep crisis, the person has to be lifted out from the crisis. So that's the reason If something has to be given as a supplemented, we should not hesitate. See, for example, if somebody is having a very severe anemia, and you think that improve Agni and open the channel and maintain the thing and it is the thing, right way we go for a blood transfusion. Our primary point is that life of a patient is a must. It should be survived. Then he can be given for any sort of other experimentations. So that is the way we should think of it, and very rational in that approach. If it is a very much severe problem, then it should be addressed accordingly. Then go for the corrections, whatever the needed.
Yeah, this is the point. Like a fanatical way of thinking Ayurveda versus practical way, and giving respect to other supplements, or wherever it is required. That kind of opening up of mindset is required. Like Madhyama Marga, there is one set of Ayurveda practitioners who are like modernized and westernized, and they think only in the westernized way. And there are other set of Ayurveda doctors, they are in totally fanatic, and samhitas, and they're digging deep into the commentaries and whatnot. So a balanced way is the way to go.
Definitely, we every information very clearly said. Ano Bhadra Kritoventu Vishwataha. We say that. Well, let the good knowledge come from every direction. And Acharya Charaka has also said everything which is said available in this universe is available in this Samhita. I have made it. It only gives an idea that we need to get it from everywhere. So when something is there which is a real thing and the patient is having problem, then we need to give them some support. Then definitely we need to approach to a condition in a very practical manner. I should not just simply because no, I can't do this one, I can't do that one. No, if it is a right time, then I should even refer the patient to the right place. Then once he is survived, then he will come back. Doctor, you have sent me to a very good direction and in time, and even doctor praised it there that for a right timely you have been referred the patient to a right place, and that's why now I'm today I'm survived. So all these things happens. So we need to be very moderate and considerate and should be rational, and we should be rigid at certain places and we should be very liberal at certain places. We should not be totally should not feel that it is a taboo. I should not look at the supplements. I should not look at the other way of no. That is not the right way of doing things. We should be open for all sort of discussions and churning. Only that manthana can only bring out the good things. That's what he said Ayurveda very clearly. Vaidya samuho nissamshaya karanam. So when many doctors are there, they're keeping all their opinions, ultimately churning. Tadvidya sambhashya buddhi vardhananam. That's the reason we need to have all these things.
So why did you go for Guggulu Tiktaka Gritha or Tiktaka Gritha? Because Tikta rasa as such is Vata increasing, and I mean, what is the logic? I mean, how it is related to bone health? Astida.
Very clearly, it is explained in Samhitas. These Tiktaka Gritha and Panchathikta Gritha and these Tiktaka Grithas are very good in Astivaha Shroto Vikaras. So why it is Astiva Shroto Vikaras? Very clearly, even though they are Tikta in Rasa, but it is in the form of Gritha. And that Gritha in that Tikta format will definitely nourish the tissues, Vata, and thereby avoids the Rukshata. So that Rukshata which is causing the brittleness and keeping the bone and everything is out, that will be cleared or saved by using Tiktaka Grithas. We can use any other Grithas also in the time, but Tiktaka Grithas will have a balancing effect. The Tikta Guna, Tikta Rasa will be, doesn't allow the Snigdha to become overriding on that. So how much it is required, that will be balanced by using these Tiktaka Grithas.
Yes, Pradeepaji, please go ahead with your question.
Namaste, Dr. Gururaja. I actually, Dr. Janardana actually asked the same question, right? Because Tiktaka Rasa is used, usually has this lekan and in fact some depletion properties. So I had a similar question. Why did you go for Tiktaka Grithas? And also, how does it help in the bone density? Is it directly related to like estrogen levels? Is it specific to women with in the menopausal phase? Or is it for anybody going through any type of bone Asthi Dhatu related issues?
it is for the Asti Dhatu related. It may be in men or women. In both the cases, it has been given because it's very clearly said Tikta Gritas are used in Asti Dhatu, Asti Majjhagata Vikaras. Very clearly it is stated. So that is a reference, Pratyaksha, from Aptopadesha. We have taken it and we are using it in different occasions and we find results. So that's why I have suggesting that it's one of the important Gritha combination which can be used in bone health issues wherever particularly there is a erosion and even there is a brittleness of bone or porosity of bone has increased and such type of things. Usually this is good.
Thank you. And a quick follow-up. You mentioned it's a good balance to not increase the snigdhata to more than an extent. So if I have a choice between Ashwagandha Gritha in a Gritha form or and then any form of Tiktaka Gritha, which one would you suggest between these two for improving bone health? And how do we know which one, if Ashwagandha Gritha can maybe increase the snigdhata to an overextent or something? Because it's a very fine balance, and I'm curious to know how you decide on these.
Ashwagandha Gritha usually contains Ashwagandha, Kshira and Gritha. That is the one combination which is available in market, usually. And if Kshira is also added, Ashwagandha is there, Gritha is there, definitely it is a more snigdha when compared to Panchathikta Guggulu Gritha. Because Panchathikta Guggulu, it is comparatively Ruksha, but it is in the form of Gritha format, so it balances the Rukshata as well as Snigdhata. But compared to which should be more Snigdha, then Ashwagandha Gritha is more Snigdha than Panchathikta Guggulu Gritha. So our intention is where to apply it. If a person is very weak, thin, built and you want to increase his bone mass, then Ashwagandha Gritha is better. But if you want to safeguard the bone health in case of a person who is above 45 years and there is a brittleness and porosity and such type of things, then it is better to go for a Panchathikta Guggulu Gritha or Mahathikta Gritha.
Yes, sir. And not related to osteoporosis, but just to stress upon the general herbs to maintain in menopause overall all the symptoms. I have a theory that because estrogen is decreasing and in some cases Shatavari is known to improve estrogen, and also Medhya effect also comes into play. I have a theory of including both Shatavari and Ashwagandha maybe in the form of tablet or powder. In a general case, it may not be in osteoporosis per se, but in general case of menopause, women approaching menopause.
That can be given in a very simple format, Shatavari and Ashwagandha in the form of Kshirapaka. If it is given in the form of Kshirapaka, it even takes care of even calcium part of it also. So it is a very easy way of handling it. Snigdhata is also there, even calcium is there, and even the estrogen protective mechanism materials are also there, and bone health maintaining materials also there. So all of them in a very good format, we can use it. No issues with that.
Moving on to questions that come. Some doctors recommend bio-identical hormonal treatment for women after menopause. What are your thoughts on this? Bio-identical hormonal treatment.
That is a hormone replacement therapy usually, and usually that hormone replacement therapies are not most recommended or even is expected out. And we as Ayurvedicians, we don't support that because most of these hormone replacements definitely causes a lot of issues. There are occasions like when there is a prostate cancer, prostate has to be removed, then certain hormone has to be maintained. For that, there is hormone replacement therapy, or even a breast cancer or ovarian cancer. If very essentially we need to support by HRT, that is hormone replacement therapy, then there is no issue. Otherwise, for simple reasons, if you go for a bioidentical hormone supplement from outside, in a long run, they themselves cause a carcinogenic and they themselves cause a lot of issues. And of course, that should be avoided.
Yes, sir. And general trend I have seen in, especially in the US, is that young teenagers, when they attain menarche and in the initial few months to few years of their menstrual life, it is expected for them to have a little bit of delayed menstruation or early menstruation. So initially it will be kind of irregular, and over a period of time it becomes regular. But the Western way of thinking in US and other countries is that if the periods are missing for 2 or 3 months, suddenly like hormone replacement therapy is the way to go. In a young age, replace. I mean, when there are natural measures available, and even the natural body when it matures, and when the body grows, the menstrual health also grows, and when there is a certainty that menstruation can be restored in a natural way, getting into hormonal therapy very early is not a very ideal situation. So.
Definitely, I don't recommend that in a very early stages going for a hormonal replacement just because 1 or 2 periods are missed and such type of thinking. It's not at all a good one. Only when I do come across a certain limitations in my practice that many times young girls will come with severe dysmenorrhea, so I mean metrorrhagia. So in that condition, there will be severe bleeding, and I try to do with lot of medications. Many a times it will succeed in stopping the bleeding, but in few cases, it's very typically whatever the drug we use. It may be even Bolabhadarasa, Prataranta Kaloha, it may be Stiplon, it may be Pushanuga, what sort of else, but there will be no result. So in that time we can't wait because bleeding is going on, and it is going to the girl will going to lose a lot of blood. So I cannot allow that to happen. So I suggest them, okay, go for hormones. Nothing, no issues. Only when there is no scope for any other drug that can be taken. But it should not be in a very early, just 1 or 2 periods missed. For that, you just go for a hormone therapy. That should never be, because the body should be allowed to operate on its own, and it is a very good thing which rectifies by itself. It should be given scope to rectify.
Yes, sir. And a question has come like, what is the usual dosage to prescribe for Tiktaka Gritha for bone health issues after menopause on a daily basis?
It's a 5 ml twice a day before food.
And how can we support right after post-COVID vaccination? This has become kind of a common. Now, some people are taking like the booster dose, and there is also theory that we should be taking one booster dose every 6 months. Some theories are coming up, and many people are feeling feverish, body ache, lethargy, headache, increased sleep. I mean, people are sleeping like 10 to 12 hours in a day, and body ache and respiratory distress, cough and cold has become common with the vaccines. How to approach that? What are the medicines and what are the therapies that we are thinking here?
See, what I have observed in the post-COVID vaccination, a very important disturbing trend, what I have observed is its effect on blood clotting, coagulation. And we have seen certain deaths also after the COVID vaccination. So that has to be taken care of. Whenever after a post-COVID exposure or a post-COVID vaccination, patient complains of anywhere headache, chest pain or numbness, be alert. There is a effect on blood vessels and blood. So immediately the anticoagulants and the blood thinning material should be given. So in Ayurveda, for that purpose, we need to go for all Amlarasa Dravyas like Naranga or Nimbuka or even sweet lemon, and even along with that Maricha and even Tulsi. Such type of sharp drugs are used in order to break up the path so that it can run. Then clotting should not take place. So our criteria should behind this, which is alarming for us, that we need to maintain this. Particularly, it's affecting the blood vessels and blood. So that component has to be taken care of. Otherwise, all these little bit cough, cold, body ache, and these things will go off with regular Sudarshana and Sudarshana Kvata and Ananda Bhairava Rasa or even Tribhuna Kirti Rasa with some medicines which can be easily manageable. The only part is that has to be taken care of. Otherwise, we have seen people with a lot of issues, and even people have died after even with the natural course of infection of the disease also landed in that type of troubles, and even post-COVID vaccination also people have landed in that trouble. So we should be very careful in handling those type of disease conditions.
Yes, sir. A case study has come. A female patient, 35 years old, Pitta Kapha Prakriti, constantly discriminated by parents, especially by mother with sibling from childhood in every quality. Even equated her education also with other child, even though had good ranking in entrance test and what all. Lost hope, probably a depression patient in everything, depressed, inferiority complex, disconnected socially, how to get out of her. We need to be very careful. Like I have two daughters. We need to be careful when praising one and ridiculing other. I mean, there should be a delicate balance. If when the balance is not maintained by parents and the child is suffering, how to go about it? So,
See, very clearly, we need to scold them when it is to be. At the same time, we need to prize them when it demands. So, we should be having the checks and balances. Simply always pointing out and curbing their things and going on scolding or irritating them and trying to tell them they're inferior and their approach is not good and everything every time, that itself will make them weaker further, and they become later burden on the family as well as even on themselves. So that's why we should be very very careful in handling those type of things always. And whenever we try to convey anything, it should be conveyed in a manner which can be understood by them. If you want to convey any information that you are feeling about your exams like this or anything like that, it should be conveyed in such a words and the way accent and everything that it should not be annoying to them. We should be able to listen to the what the observation you have made. If that type of convincingly, if you convey that this is the thing where you went wrong, and you have all the scope to correct it in the next occasion. Please concentrate on this. So when you give with the suggestion where you went wrong, what should be done, and how you can do it next time. So when such type of things are explained, definitely they will not feel bad, and then they will go for the correction mode. Otherwise, simply blaming and cursing and doing lots of things, then they will be in a, they'll just go inside. They'll go inside the shell, and then that becomes a big issue later.
so I mean, in terms of medicines, probably Brahmi Gritha, Manasamitra Vatakam, Ashwagandha, Ristam, all those things play a role.
Those things will only play a role when a particular condition is demanding. But here, you know where you went wrong, what you have done wrong. You correct that first. So if you correct the way we communicate to the girl, child, or something like that, and pamper them as required, then definitely they will come out. And that in those conditions, when the tracks are clear and they are ready to grab things, then some supportive mechanisms like Brahmi Gritha and these things, if it is given, definitely it will help them in their decision making and the clarity in identifying the right and wrong, and even absorbing and even improving the learning process. Everything will be.
Probably parents should be brought in separately and they should be counseled like, you're doing a little bit injustice to her and it's affecting her. I mean, though you may, to the parents, they may or may not be doing any wrong thing, but in the child's point of view, it's not going right. So pamper them, pamper her a little and boost their confidence and, try to make a balance. So, I mean, taking them into confidence is also very important, because whatever the medicines that we give to the child, if the parents' methods are not corrected, it keeps on repeating and the same thing will go on.
Definitely, Nidana, if continuously pouring in, then the new pathology will be developing. So, Nidana Parimarjana Meva Chikitsa. First, you need to avoid the Nidana. What the Nidana is your way of mentoring, or your way of pointing out, or your way of pressurizing. So, that itself is a Nidana. Then that is a causative factor. That has to be removed first. Then we need to have a lot of other ways of mending it, and we may have to spend quality time with them and explaining them what to do, how to do, where to do. All these things, if it is done, definitely it will boost their confidence, and automatically they'll later definitely do and come out with good colors. So that is the way we need them to bring out of these things. Otherwise, we are pushing them in deep into the depression.
Yeah, I see a lot of questions. I'll make it a list. We will discuss that next week. Just to end this on in a funny note, Diptiji writes, in our household, she has two daughters. In our household, we have equal opportunity of yelling. Means if one gets in trouble, the other will also get into trouble, and both will be yelled. So appreciating equally and also yelling also equally. That's probably a nice way.
It should be always that entirely depends on the way you behave in the house. If you are supportive, if you are something like a mentor, and you will be coaching or guiding them and trying to come out this and bring them to such a level, and when they perform and they do, and you feel happy for them, and if you show your happiness, then definitely they will be in the right way. Just only pointing out the wrong things, and when it's a good thing is that you're keeping silent, that is also not right. So we always do that one. Whenever there is a sambar has extra salt, we point out, today there is a more salt. But when the sambar was nice, we never say anything. We simply keep and eat. So that should not be. We should always prize whenever there is a right thing. And of course, then only we have a right to point out the wrong things.
Okay, so that's a wrap for today. Thank you all the participants. Thank you all, and especially thank you very much, Gurubodha sir.
Thank you all the participants.